So this was an interesting presentation overall. We had a patient interview, and the patient, who had a 20-year course of PV, was really very moving in how they described when they were told the diagnosis at the beginning and the shock of that, how things had changed, how then treatments had changed, and how they were now, where they looked quite very positively to the future. So I think that was insightful for the audience and showed more than perhaps as doctors we just go, here's your diagnosis, this is what you have to do. What the presentation I gave in that session was about what were the treatments and what was the evidence for treatments, particularly for patients who no longer were responding to first-line treatment, where we looked at results of the response trials, MAJIC, which is a very encouraging study, which of course I was involved in, and then some of the long-term follow-up data on patients on interferons, and showed a number of options that we now have for patients who fall into that need of second-line treatment. So it was quite encouraging, really.